Imagine waking up one day to discover that your daily routines, things you take for granted, are silently harming your kidneys. It's a startling thought, isn't it? Your kidneys may be small, but they are incredibly important, working tirelessly around the clock to filter waste, regulate fluids, and maintain your overall health. However, without realizing it, you might be hindering their ability to heal and function properly. In this video, we will reveal 10 everyday habits that could be detrimental to your kidney health. Stay with us until the end, because the most harmful habit might surprise you, and breaking it could potentially save your kidneys. 1. Holding in your urine too long. Holding your urine is a common habit, often occurring when you are busy with work, in a place where it is inconvenient to use the restroom, such as being stuck in traffic or working outdoors, or too focused on something else and forget about the need to urinate. While it may seem harmless, holding your urine for extended periods and repeatedly can seriously harm your urinary system, especially your kidneys. Holding your urine can have several negative effects on your body. When you hold your urine, it builds up in your bladder, causing it to stretch excessively. This can weaken your bladder muscles over time, making it difficult to empty your bladder completely. This can lead to residual urine, which increases your risk of urinary tract infections, UTIs. UTIs occur when bacteria in urine have time to multiply. Holding your urine gives these bacteria a chance to grow, increasing the risk of infection. If the infection spreads to your kidneys, it can cause kidney inflammation, leading to serious kidney dysfunction. Holding your urine can also contribute to kidney stone formation. When urine is not excreted promptly, minerals like calcium, oxalate, and uric acid have time to crystallize, forming kidney stones. Kidney stones can cause severe pain, infections, and long-term kidney damage. Finally, holding your urine can lead to urine reflux, where urine flows back up into the ureters, tubes connecting the bladder and kidneys. This puts pressure on the kidneys and can damage them. If this condition persists, it can lead to kidney failure. 2. Overusing painkillers. Many people use over-the-counter pain relievers like ibuprofen, aspirin, naproxen, and other NSAIDs to alleviate headaches, muscle aches, joint pain, or fever without consulting a doctor. Some individuals overuse these medications for extended periods without realizing their potential negative effects on the body, particularly the kidneys. Non-steroidal anti-inflammatory drugs, NSAIDs, can affect kidney health in several ways. They work by inhibiting the enzyme cyclooxygenase, CHOX, which reduces the production of prostaglandins. Prostaglandins are important chemicals that help dilate blood vessels and maintain blood flow to the kidneys. When prostaglandins are inhibited, blood vessels constrict, leading to reduced blood flow to the kidneys. This can impair the kidneys' ability to filter waste products and maintain fluid and electrolyte balance. Regular use of NSAIDs can also lead to analgesic nephropathy, a condition characterized by chronic kidney damage caused by inflammation and damage to the internal structures of the kidneys. This condition often goes unnoticed in its early stages, but can eventually lead to irreversible kidney function decline. In individuals at higher risk, such as the elderly, those who are dehydrated, or those with underlying conditions like diabetes or high blood pressure, NSAIDs can cause acute kidney failure, a serious condition where the kidneys suddenly lose their ability to filter waste products. Long-term use of NSAIDs can also lead to the accumulation of minor kidney damage, eventually resulting in chronic kidney disease, where kidney function gradually declines over time. 3. Consuming too much salt. Salt sodium is an essential part of our daily diet, but many people consume more than the recommended amount through processed foods like snacks, canned goods, and cured meats. Other contributing factors include adding excessive salt during cooking and using sodium-rich seasonings like bouillon powder, fish sauce, and soy sauce without paying attention to the sodium content. Sodium in salt is crucial for maintaining fluid balance and supporting muscle and nerve function. However, excessive salt intake puts a significant strain on the kidneys and the body. Excessive salt intake can lead to several health problems, including fluid retention and high blood pressure. When you consume too much salt, your body retains water to dilute the sodium in your blood. This increases blood volume, leading to high blood pressure. High blood pressure, increased pressure on blood vessels, can damage small blood vessels in the kidneys, reducing their ability to filter blood and remove waste. Increased burden on the kidneys. Your kidneys are responsible for filtering and eliminating excess sodium through urine. When sodium levels are too high, your kidneys have to work harder, leading to wear and tear and reduced efficiency over time. Increased risk of chronic kidney disease. Prolonged high blood pressure due to excess salt intake can damage the structure of your kidneys, reducing their function and leading to chronic kidney disease. Kidney stone formation. Excess sodium increases the amount of calcium in your urine, increasing the risk of kidney stones. Solid crystals that can cause pain and damage your kidneys if left untreated. Electrolyte imbalance. High sodium levels can disrupt the balance of important minerals like potassium and magnesium, leading to impaired kidney function. 4. Not drinking enough water. Many people don't drink enough water throughout the day due to various reasons. They might be too busy, not paying attention to their body's needs, or simply not feeling thirsty often. Additionally, substituting water with other beverages like coffee, tea, and soda can reduce the intake of pure water. Your kidneys need water to perform their essential functions of filtering blood, removing waste products, and maintaining the body's fluid and electrolyte balance. Water helps dilute urine, reducing the risk of kidney stones and urinary tract infections. Dehydration can have serious consequences for your kidneys. When you don't drink enough water, your kidneys can't effectively filter and remove waste products, leading to a buildup of urea, creatinine, and other toxins in your blood. This can cause blood poisoning or increase the risk of damage to other organs. Dehydration can also increase your risk of kidney stones. Concentrated urine contains high levels of minerals like calcium, oxalate, and uric acid. When you're dehydrated, these minerals are more likely to crystallize and form kidney stones, causing pain and kidney damage. Dehydration can also lead to urinary tract infections, UTIs. Concentrated urine provides a favorable environment for bacteria to grow, leading to UTIs. If left untreated, these infections can spread to the kidneys, causing inflammation or kidney infections. Dehydration can also reduce the efficiency of your circulatory system. Dehydration decreases blood flow to the kidneys, preventing them from functioning optimally. Prolonged reduced blood flow can cause long-term damage to the small blood vessels in the kidneys. Dehydration can also increase your risk of kidney failure. Chronic dehydration can lead to electrolyte imbalances, severely affecting kidney function and potentially causing acute or chronic kidney failure. Finally, dehydration can reduce your ability to control blood pressure. Your kidneys need enough water to produce the hormone renin, which regulates blood pressure. Dehydration can interfere with this process, leading to abnormal blood pressure. 5. Ignoring high blood pressure. High blood pressure, also known as hypertension, is often overlooked because it doesn't have obvious symptoms in the early stages. Many people don't check their blood pressure regularly, or they don't follow their treatment plan after diagnosis, which can lead to serious damage, especially to the kidneys. Your kidneys contain many tiny blood vessels, known as glomeruli, which are responsible for filtering your blood and removing waste products. Blood pressure is the force that pushes blood through these vessels, allowing your kidneys to function effectively. When high blood pressure is left unchecked, it can damage the blood vessels in your kidneys, leading to a decline in kidney function. High blood pressure can damage the blood vessels in your kidneys. This happens because the high pressure puts a strain on the blood vessel walls, causing the small blood vessels in your kidneys to thicken, harden, or even tear. This damage reduces the kidney's ability to filter blood, leading to a buildup of waste products and toxins in the body. High blood pressure is a leading cause of chronic kidney disease, CKD. CKD can progress and lead to end-stage renal failure, which requires dialysis or a kidney transplant. High blood pressure can also increase the risk of proteinuria, which is the presence of protein in the urine. Proteinuria is an early sign of kidney damage and can lead to kidney failure if left untreated. When the blood vessels in your kidneys are damaged, the kidney's ability to filter blood is impaired, leading to a buildup of fluid and waste products in the body. High blood pressure also increases the risk of developing diabetes, atherosclerosis, and heart disease. all of which can directly or indirectly affect the kidneys. 6. Smoking. Smoking is often seen as a way to relieve stress or a social need. However, beyond its clear negative impact on the lungs and heart, smoking also seriously affects kidney function, a fact that many people are not fully aware of. Your kidneys are vital organs that filter your blood, remove waste products, regulate blood pressure, and balance electrolytes. The tiny blood vessels in your kidneys are very sensitive to damage, and smoking can impair their function. Smoking can significantly impact your kidney health. The harmful chemicals in cigarettes, such as nicotine and carbon monoxide, constrict blood vessels, reducing blood flow to your kidneys. This decreased blood flow hinders the kidney's ability to filter waste products, leading to a buildup of toxins in your body. Smoking also damages the inner lining of blood vessels, causing inflammation and promoting the development of plaque. This damage reduces kidney function and increases the risk of kidney failure. Furthermore, smoking increases the risk of developing chronic kidney disease, CKD, and accelerates its progression in those already diagnosed. Smokers have a higher likelihood of experiencing end-stage renal disease, ESRD, compared to non-smokers. Cigarettes contain cadmium, a heavy metal directly linked to kidney cancer. Long-term smoking increases the risk of kidney cancer by 2 to 3 times compared to non-smokers. Smoking also elevates blood sugar levels and hinders blood sugar control in individuals with diabetes. Combined with the vascular damage caused by smoking, this can accelerate the progression of diabetic nephropathy. Nicotine raises blood pressure, a major contributor to kidney damage. Smoking exacerbates the effects of other risk factors, such as obesity and high cholesterol. Smokers often respond poorly to treatments for high blood pressure or diabetes, increasing the risk of kidney damage. 7. Drinking too much alcohol. Alcohol consumption is prevalent in social gatherings, parties, or as a means of stress relief. Many individuals consume alcohol beyond recommended limits or on a regular basis, often unaware of its detrimental effects on kidney health. Your kidneys are responsible for filtering your blood and removing toxins, including alcohol. When you drink too much alcohol, your kidneys have to work harder to eliminate these toxins, which can affect their ability to maintain proper water and electrolyte balance and filter your blood effectively. Alcohol consumption can have a detrimental impact on kidney health. It acts as a diuretic, increasing urine production and leading to dehydration. Dehydration reduces blood flow to the kidneys, impairing their ability to filter waste products and leading to a buildup of toxins. Alcohol also constricts blood vessels, further reducing blood flow to the kidneys and compromising their filtering function. Excessive alcohol use can directly damage kidney tissue, increasing the risk of inflammation and long-term structural damage. Regular alcohol consumption is associated with an increased risk of chronic kidney disease, CKD, particularly in individuals with pre-existing conditions such as diabetes or high blood pressure. Binge drinking can lead to acute kidney injury, AKI, a sudden loss of kidney function. Alcohol also raises blood pressure, damaging kidney blood vessels and contributing to kidney failure. The liver and kidneys work together to eliminate toxins. Excessive alcohol consumption can lead to liver cirrhosis, placing additional strain on the kidneys and potentially resulting in hepatorenal syndrome. Alcohol can also disrupt fluid and mineral balance, increasing the risk of kidney stone formation. 8. Eating processed foods. Processed foods are foods that have been industrially treated to extend their shelf life or enhance their flavor. These include fast food such as pizza, hamburgers, and fried chicken, packaged foods like instant noodles, snacks, and frozen foods, and processed foods such as bacon, sausages, and canned goods. While these foods are often chosen for their convenience and taste, they can contain many ingredients that are harmful to your health, especially your kidneys. High sodium, salt content. Sodium is the main component of salt, and it is often found in high amounts in processed foods. Your kidneys have to work harder to eliminate excess sodium, which can put extra strain on them. High sodium levels also increase blood pressure, a major contributor to damage to the small blood vessels in your kidneys. Preservatives and chemical additives. Processed foods contain many chemical preservatives, such as nitrates, nitrites, or artificial colors and flavors. These substances increase the toxic burden on your kidneys as they filter and remove these additives from your body. Sugar and artificial sweeteners. Processed foods often contain refined sugar or artificial sweeteners. High sugar intake increases the risk of obesity, diabetes, and kidney damage by raising blood sugar levels and promoting chronic inflammation. Saturated and trans fats. These types of fats contribute to increased bad cholesterol, which can lead to atherosclerosis, reduced blood flow to the kidneys, and impaired kidney function. High animal protein content. Processed meats like sausages and cold cuts contain high amounts of protein that can be difficult to digest. Excess protein increases metabolic byproducts like urea, putting additional strain on your kidneys. 9. Consuming excessive sugar. Sugar is a common ingredient in many everyday foods and drinks, including sugary beverages, soft drinks, milk tea, and bottled juices. Processed foods, candy, pastries, snacks, and breakfast cereals. Hidden sugars found in seemingly unsweetened products like ketchup, sauces, and bread. While sugar provides quick energy, excessive consumption can lead to various health issues, particularly affecting the kidneys. Excess sugar can negatively impact various bodily functions, particularly increasing the risk of developing conditions like diabetes, obesity, and high blood pressure. These are all major contributors to kidney damage. Excessive sugar consumption can significantly increase the risk of developing diabetes, high blood pressure, obesity, and kidney problems. High sugar intake leads to elevated blood sugar levels, which can cause insulin resistance and type 2 diabetes. Uncontrolled diabetes can damage the small blood vessels in the kidneys, leading to diabetic nephropathy and impaired kidney function. A diet rich in sugar, particularly fructose found in refined sugars, can increase uric acid production, causing vasoconstriction and high blood pressure. High blood pressure is a major contributor to kidney damage and impaired kidney function. Excess sugar is converted into fat, contributing to weight gain and obesity. Obesity increases blood flow to the kidneys, putting pressure on the glomeruli, which can lead to damage and chronic kidney disease. Sugar triggers chronic inflammation in the body, damaging kidney cells. Oxidative stress weakens the kidney's ability to repair itself, leading to long-term damage. Sugar, especially fructose, increases uric acid and oxalate levels in urine, promoting crystallization and the formation of kidney stones. Excess sugar weakens the kidney's internal balance mechanisms, increasing the risk of infections and blood vessel damage. 10. Neglecting diabetes management. Diabetes, particularly type 2 diabetes, is a common condition, but many people struggle to manage it effectively due to factors such as not adhering to a suitable diet and lifestyle, infrequent blood sugar monitoring, and inconsistent use of prescribed medications or insulin. As a result, prolonged high blood sugar levels can lead to damage in various organs, especially the kidneys. Diabetes is a leading cause of chronic kidney disease, CKD, and kidney failure. High blood sugar levels over time damage the small blood vessels in the kidneys, glomeruli, reducing their ability to filter blood and remove waste products. High blood sugar levels can damage the blood vessels in your kidneys. This damage causes inflammation and thickening of the filtering membrane in the glomeruli, which reduces their ability to filter blood. When the glomeruli are damaged, waste products build up in the blood, putting pressure on the remaining structures. This damage can lead to protein leaking into the urine, a condition known as proteinuria. Proteinuria is an early sign of diabetic nephropathy and can lead to kidney failure. Uncontrolled diabetes also increases the risk of high blood pressure, a major factor in kidney damage. High blood pressure worsens damage to the blood vessels and glomeruli. Diabetic nephropathy progresses slowly but steadily, leading to chronic kidney disease, CKD, if left untreated. If diabetic nephropathy is not managed, the kidneys may completely lose function, requiring dialysis or kidney transplantation. Diabetes can also disrupt the balance of water and electrolytes in the body by reducing the kidney's ability to filter and excrete substances like sodium, potassium, and phosphorus. High blood sugar levels can also increase the concentration of uric acid and oxalate in the urine, contributing to the formation of kidney stones. Your kidneys are remarkable organs, diligently working to maintain your health every day. However, they require your support. By avoiding harmful habits and making small, consistent changes to your daily routine, you can provide your kidneys with the care they deserve and protect them from serious damage. Remember, it's never too late to prioritize your well-being. If you found this information helpful, please consider liking, sharing, and subscribing. Let's work together to empower more individuals to take charge of their kidney health. Thank you for watching, and we look forward to seeing you in our next video.